The ultimate treatment for abnormal vaginal bleeding is hysterectomy. Whether your abnormal vaginal bleeding is because of a hormonal imbalance or whether it's because of a structural problem like fibroids, the one thing that can be guaranteed to fix the bleeding is hysterectomy. However, hysterectomy is a big gun. It really is a permanent solution. It removes the uterus completely, and it's a fairly big surgery. So you have to take hysterectomy pretty seriously. It's not something that you just jump into lightly. However, it is the one thing that will definitely solve the problem. So what exactly is a hysterectomy? Hysterectomy is removal of the uterus. Now the uterus, the opening of the uterus is the cervix, and for the sake of hysterectomy, we sort of consider the uterus separate. It's interesting because the medical term that we use is either a total hysterectomy or a subtotal or partial hysterectomy. A total hysterectomy means that we remove both the uterus and the cervix. In a subtotal or a partial hysterectomy, we leave the cervix in but remove the uterus. I find that interesting because most lay people, when they talk about partial hysterectomy, in their minds are thinking about leaving the ovaries. But from a medical point of view, when doctors talk about hysterectomy, the ovaries are a totally separate thing. And so we talked about a hysterectomy, whether it's a total hysterectomy, a subtotal or partial hysterectomy, and then whether or not we do what's called a BSO or bilateral salpingo oophorectomy, which is removal of the ovaries. It's really a separate thing. So if a doctor talks about a partial hysterectomy, it may mean something different than what you're thinking. So you want to ask them what exactly they're talking about so you understand. If the cervix is left behind, there is a chance that you could still have bleeding from the cervix. And so taking the cervix out is the total guarantee that you won't have bleeding afterwards. Leaving the cervix in is not always the wrong thing to do, but it does not guarantee that your bleeding will stop. Now, hysterectomies are done different ways. A hysterectomy can be done through what's called an abdominal approach or an abdominal hysterectomy, and that's done through an open incision in the tummy, either across like a C-section or occasionally it has to be done up and down. Hysterectomy can also be done vaginally. It's called a vaginal hysterectomy, where the uterus is removed through the vagina with no incisions in the abdomen at all. You can have a laparoscopic assisted vaginal hysterectomy, and that's where a camera is put in through the belly button and a couple other instruments. Some work is done through the laparoscope, through the camera, and then the doctor moves down below and removes the uterus through your vagina. That would be a laparoscopic assisted vaginal hysterectomy. And finally, hysterectomies can be done laparoscopically, where there's just small incisions in the tummy and the uterus is taken out piece by piece through those incisions without any big incision in the abdomen whatsoever. What type of hysterectomy you have really depends on a lot of factors. It depends on the size of the uterus, depends on how many children you've had, it depends on previous surgeries, and to some extent, it depends on how much risk you're willing to take. The absolute safest way to do a hysterectomy is an abdominal hysterectomy. You can control the bleeding best, you have more control over adhesions and other structures, but it's not always the right way to go. But if you ask me what's the absolute safest way to do a hysterectomy, it would be an abdominal hysterectomy. So women that have significant risk factors or aren't willing to take much risk, that would be the way to go. So for instance, an example of a risk factor that might drive someone to do an abdominal hysterectomy versus say a laparoscopic hysterectomy is, let's say that for some reason you are adamantly opposed to having a blood transfusion. If you're in that category, it may not be worth the risk to do a laparoscopic hysterectomy, and that would be one thing that would push the doctor towards an abdominal hysterectomy because it decreases the risk and makes the surgery a little safer. Now, a vaginal hysterectomy, if you're a candidate for it, is a very nice way to do a hysterectomy because there's no incisions at all on the abdomen, which makes the recovery very simple. It also decreases on scarring. The uterus is taken out through the vagina. You're usually just kept in the hospital overnight and able to go home, and depending on the type of work you do, back to work in 2 to 4 weeks. In order to be a candidate for a vaginal hysterectomy, your uterus has to be small enough to fit through the vagina, and usually we like to have women that have had at least one child vaginally before because it opens the spaces up. Furthermore, if there's been abdominal surgery in the past, that can cause scar tissue to the uterus, which could make a vaginal hysterectomy difficult or impossible. So those are all factors that go into it. Laparoscopic hysterectomies can be a very nice option as well because they can be done, and in some cases you could go home the same day or the next day with only one night in the hospital. Recovery time is also very short, about 2 weeks for laparoscopic hysterectomy. They do take longer, so there's longer operating time, which means you're going to be under anesthesia for longer because instead of taking the uterus out in one piece, it has to be removed in small little pieces through these little holes, and that can take time. Also, because of the nature of how we're approaching the uterus, there's a little bit higher risk of bleeding during the hysterectomy. And there's also a slightly increased risk of injury to other tissue, for instance, injury to your bladder or injury to your intestines. And so the laparoscopic hysterectomy in the appropriate patient is a very nice way to have a hysterectomy, but there is increased risk. So again, there's this sort of risk-benefit decision that has to be weighed, and it'll depend on your unique situation.
Medtwice.com